let's start in the center, Dr. Trivedi. And Israel, let's talk a little bit about where we are right now. We have the title of this panel, Are Children All Right now?
So I think just to start off, I would say thank you to the Banner for putting together this wonderful event, and I think such meaningful conversations already. When we talk about kids, I think one of the things to think about is we come from this place where you say, well, you know, kids are so resilient. And I think when you look at the statistics, what's really important is the fact that when you look just at adolescents, 12 to 17 years old, right now in Maryland, we have 47,000 kids that are clinically depressed. If we look back to the last year, only half of them have gotten any treatment at all. So some of our statistics of are we getting to these kids are as bad as a third world country. When I look at Baltimore City schools, 1 in 4 kids has reported having suicidal thoughts in the last year. When you look across the state and the needs that kids have, things have only gotten worse during the pandemic. Kids that had IEPs or needed IEPs not getting the right services, and just so many more families struggling at the same time.
And what children are we seeing being affected most often?
So, I also want to first start by thanking, the Banner and all of the event coordinators and everybody for attending today. I would say that there are 2 statistics before we get started that always are alarming to me and comforting at the same time. The first statistic is that we have seen a tremendous growth in people willing to recognize, especially in the youth, to say, I need help, I need assistance, I'm not okay. And so I always want to start by celebrating the success, especially the wonderful work like the First Lady has done and all of our partners here today to be able to make sure to destigmatize mental health, and I think that's important. To the point that now about 40% of all children have reported at some point or will say or register that they've had a feeling of depression or hopelessness or concern and they wanted assistance. And so that means that we're moving forward. It's no longer a secret. It's okay to not be okay. It's okay to say that we have challenges and to go out and seek help. But at the same time, the greatest cause of death for children now is to be a victim of mass shooting. And when we look at those events, mental health is usually always behind it. So while we're doing better at diagnosing, we need to do better at treating. And I would say those are the 2 things that really frame what we need to do today, is that it's okay, we've made progress, but we also need to look at those warning signs where things are at. And I would say that we're seeing a lot of those events and mass shootings and others are always usually tied to a mental health disorder or something happening that we need to escalate and be more involved in.
Yeah. First Lady Moore, can you talk a little bit about what this administration is doing to address this and why this is an important issue to you?
Thank you, John, and thank you to the Banner for this really, really important conversation. I believe that the mental health crisis is a crisis of a generation, and the Moore Miller administration has really taken the initiative to invest significantly in mental health support at the tune of about $200 million. And the administration is choosing to follow the science. And as my panelists, colleagues have set up here, it is okay to acknowledge that our children are having challenges and are not okay. But there are many organizations throughout the state and healthcare professionals who are doing the work and need the support to be successful. So I'm really proud of the partnerships that we have established. We've also established the first in the nation Trevor Project partnership where we are working to reduce LGBTQ suicide rates. So there is a lot of work that's being done.
Absolutely. Bailey Ann, you have a unique perspective at being a military wife and being part of the LGBTQ community. Both of those communities have dealt with mental illness and mental health disparities. Talk a little bit about how you have overcome some of the vitriol that you receive online and things of that nature. We've talked about that in the past, but How do you stay strong, and how do you encourage others?
Well, first and foremost, I just want to say thank you so much to the Baltimore Banner for having me here, and also our incredible idols that I have looked up to for having me here. And I have to say that I have gone through the immigration process where I was bullied heavily for being who I am and being different. And then when I decided to transition, all thanks to the help to Kaiser Permanente, Dr. Rocha for helping whenever my family was in need, I was able to transition medically, and through all of that, the most important thing that I have to say is, as Miss Marilyn USA, I've always tried to advocate for having that right bubble of people that is surrounding you to support you, and especially my mom.
What advice do you give to youth who do not necessarily have that type of bubble and support?
Oh my gosh, it can come with various things, in terms of family members or teachers. My MCPS, educators have been the backbone in helping me to come to who I am, the woman that I am today, and all thanks to them.
Yeah. So Dr. Trivedi, the 1 in 4 number and the, was it 48,000? Those numbers are startling. What can be done immediately to address that?
Sure. So, I think the positive thing I will say is that there is so much we can do. I think some of the wonderful work done by the administration in terms of the CHRC grants to bring more school-based mental health services. We're over about 250 schools right now across the state. There are things that we can do in terms of impacting youth where they are. For example, in Montgomery County, we have programs that help kids who are undocumented get access to resources so they don't end up in gangs, so that they actually are able to get the services they need.
Can I stop you right there? I want to talk about that intersectionality. So you're dealing with a community that there might be a language barrier, or there might be other things at work. How do you fine-tune that so you directly reach those communities? Many of them are invisible and don't necessarily have much representation.
Agreed. I think this is true in so many different ways. I think one of the wonderful things about our state is truly how diverse we are, but we also find, I think, meaningful solutions. And so I think for us, it's been a combination of, I will say for us, we are braided funding of about 200 different sources, a lot of county grants that come in to step in because these people will not be documented. They may not necessarily be on Medicaid or have insurance. Finding the resources. More importantly, I think it's being able to have people on our teams that look like the people that are getting the care. It's also about having programs that meet people where they're at, whether it's our mobile crisis teams that literally go all across the state, meeting people under bridges, in churches, everywhere else, to all of our school-based programming. The other big thing that I would just say is, as much as you mentioned kind of what's the immediate need now, I think we can think about prevention all we want. The reality is there are kids stuck in emergency rooms today that can't access care. We right now, I will just say, operate about 130 inpatient beds for kids. I will say we are ready to build 100 more and could do that tomorrow if but for the funding. And I think these are kids that right now are stuck in our system. When you look at juvenile justice involved kids, 7 out of 10 have a mental health diagnosis. How many of them are being treated? So we actually have the capacity. Shepherd Pratt every year, and I gave you that number of about 46,000. The point is that we touch 15,000 of those kids today.
Yeah.
We could easily scale to meet all of those needs tomorrow if but for the support.
First Lady Moore, you are raising 2 children in the spotlight, in a pioneering role, quite frankly. How do you deal with their making sure that they are mentally healthy and that they avoid some of the vitriol that we see online? How do you protect your children?
Well, just like parents all over the state of Maryland, it is a battle every day. I and my husband have chosen to follow the science in our home. And we know that social media, for example, is something that has real, lasting triggers on mental health. And so our children, 10 and 13, have very, very limited access to social media. They are not on Instagram. They are not on Facebook. They are not on X. YouTube is a little more difficult to control, but we do pop-ins and to see what is being populated in their feeds. And I have said, and Wes has said, you know, our job is not to be your best friend. Our job is to raise the best person we can raise. And sometimes that's going to be making the difficult decisions to have to say no about things that they want. And to understand that socializing and social media is actually not socializing.
How do you keep them from the screens? How do you keep them from these social media sites? It sounds like almost like a mission impossible.
Well, it's a lot of no's in our house, right? It's a lot of no's. And, but there's also, you know, you can't just say no and then not have anything else. So we spend a lot of time doing a lot of activities, a lot of dancing. Our daughter dances a few days a week, 4 days a week. Our son is into sports. It is difficult in living in Annapolis, where you're a little bit in a fishbowl. We don't have a lot of neighbors. And so we have to make the best effort on behalf of our children because they didn't ask for this life. And so we do what we can do, and we have a great community. I see my mother-in-law and sister-in-law are here. We tap into our community. We have that ability to be able to do that, and we do our best, but we acknowledge that it is a struggle every day. And I know as First Lady, if I am struggling and have resources, I know other parents are struggling. And so, for example, on October 6th at Government House, we are opening up the house so that we can have a day of wellness. We are choosing to use Government House not as just a place to have nice cocktail parties and holiday functions, but to be a gathering space where we can come together to talk about real solutions that are affecting Maryland's families.
Israel, how does Maryland, in your opinion, rank in this region and in the country as far as access and people being able to address these issues?
You know, what I would say is that I think Maryland is doing an amazing job in bringing resources. I think there's always more that we can do. I can say just from what I've seen and what Kaiser's working with, and I can talk about the commitment of everybody willing to build the community. So Kaiser recently just had, as people went back to schools, we had a Thrive seminar, and it was full. We packed our entire conference center, a meeting with school officials and leaders to talk about what could we do to build the community. And so Kaiser Permanente has worked in partner with schools to train people about mental health first aid, because the best way to combat the issues of social media, and we need to understand what social media does. It's speed and access. What used to take people weeks, months, that teachers could understand that someone was withdrawing, that a student was having issues, can happen overnight. And they can spread a video, they can spread a meme, they can spread a text, and instantly within minutes you need to manage a situation and get to a student immediately and de-escalate. And teachers are amazing resources, but they're not mental health professionals. So we need to train them for mental health first aid, how we can partner. So what I can say that I see a strong commitment in Maryland, even today, a willingness to talk, a willingness to come together, and a willingness to build a community with resources. So what we are doing, and what Kaiser's doing to help even fortify more of Maryland's commitment to behavioral health, is to bring those resources, bring mental health professionals to our teachers. How can we build the community? What can we train people to say, here are the signs you should know, here's what's available, and here's how you can help. So the minute that you see that happen, the minute you see someone withdraw, or you hear that there's an event happening on social media, you can move forward. Because that's why social media is so impactful, is that it can be destructive in a way to spread something so quickly, and then the time that we have to react, to intercede, and to get someone help is that much shorter. So what we can do is build a community, and then there's a lot of discussions that I've seen, and very, I do want to give a lot of respect for those school leaders who've said, we're going to limit social media. You saw it this week, there was a lot of discussions about school districts saying we're going to have certain timeouts, we're going to take certain phones, we're going to do that. Whether that's the right answer or not, we will know into the future, but I think the desire and willingness to keep those things moving forward, to take courageous actions, shows Maryland's commitment, so I think we're doing well, and we want to continue on that amazing progress.
Talking more about social media because it's such a big part of life. What are the trends that we are seeing, and as it's changing so fast? New platforms come out all the time. How do we keep on top of it? Especially if you have parents who are not as active or involved as the First Lady.
Sure. So, I think one of the things I would say for any parent is it feels like this daunting task, right? There's a simple statistic I'm going to give you, which is what we see is right now, when you look at adolescence, the average child is spending 5 hours on the screen each day. What the studies actually show is if you can get a kid to be on the screen for 3 hours or less, the rates of depression, the rates of suicidal thoughts, the rates of these things decrease by half, right? So when we're talking about what can any parent do, I think it's to be mindful, first of all, of at what age does a child really need a screen? When they're still in a stroller, do they really need that screen right in front of their thing to play with? I also say, I think getting back to the school teachers and that piece, my son just started high school, and one of the best things that the high school has done is to say no cell phones all day. And so I think there are things that can be done. I think really if we want to make a difference, and particularly for social media, I would say it's a joint commitment. There are some school districts where I will just say, where moms have gotten together and that, yes, when your child finally needs a cell phone in 8th or 9th grade, guess what? They're only getting a flip phone, they're not getting a smartphone. So you can't access all those apps. The other thing I would say is there's just common, practical, common sense things. The screen should not be in a child's bedroom. It should be where everyone can see it, right? And so there are things that we can do each day that actually fit to the structure of any household, and it's also about getting those things out. The last thing I'll just say is when we talk about a community, our kids spend so much time with sports teams, with coaches. One of the things that I'm particularly excited by is our partnership with the Ravens, where we've done a mental health boot camp for coaches, because I think similar to teachers, how do we let them know as they're spending hours and hours with our kids on various activities, if you want to be elite, if you want to perform, you also have to take care of your mental health, which also means getting off the screen. But how do you manage crises, not by texting, but by actually talking to other people? That's been a wonderful collaboration.
Bailey Ann, I know that you are a competitive dancer. What other outlets do you have to keep you grounded and to, just keep you healthy?
Well, honestly, besides my Labradoodle and Golden Doodle, my husband does a great job at taking us outside and getting vitamin D and, also eating a balanced diet too. That's very important.
I'm in trouble. Talk about the not clapping back. We have talked about that before, and for those who don't know, that's like responding to what nasty things that people are saying. How do you just bite your tongue when you're getting, hit with a... Yeah. Oh,
The crown kept me from talking. So sorry. But I think, to have a sense of awareness and the confidence in knowing who you are is very important, because something that, my mom have always taught me is to know who you are on the inside, and knowing that the people who say mean, nasty things to you probably don't even know who you are. And if they give you a shot and getting to know who you are on the inside, they probably have a change of mind, and they probably realize that we all have something in common than not, So I try to remember that.
I wanted to talk a little bit more about the school shooting aspect that we were talking about earlier. It's a reality, unfortunately. How does that play a role in the long-term effects of students on an everyday basis? Those who haven't even experienced it, but the threat of having that.
Sure. I'll start off, and I'm sure there'll be more to say. But, one of the things I'll just say is for many kids, there's vicarious traumatization. So the fact that you see a school shooting happening anywhere in the country, particularly for younger kids, it's this could happen in my school too. They can't tell the difference between what's 2 miles away versus 2,000 miles away. The second thing I will say, and so we are the largest provider of non-public special education in the state. We have 11 schools across the state. We've done active shooter drills, and what do you do? And it's such a sad statement to say this is where we're at as a community. But I think part of that also is kids need to feel safe and secure to be able to be in a place where they can learn. And when there's violence in the school, you can't focus on actually learning the things that are really hard to learn. The last part of it I'll just say, and I think this is true, is, Israel did mention the fact about mental health is connected to shootings, but what the data really shows is it's people with mental health issues who are actually the victim. They're not the one with the gun doing the shooting. That's what the media wants to show.
Hold on.
That's not the reality.
Hold on. I'm not pushing that narrative. So I want to address that. It seems that I cover diversity, equity, inclusion through the lens of race and culture. And it seems that over and over and over again, when we see white children who are the shooters, we immediately are saying it's mental illness, this and the other. When there is a black person who is a shooter or this and the other, mental illness does not come up. Can we talk a little bit about that and our selective sympathy that we have and the way that we are, victimizing certain groups and not victimizing others, or not applying that same lens?
Sure. So, I will just say, I think, the unfortunate part is really, you asked the question about, like, how do you get into communities, particularly communities where maybe there are differences and vulnerabilities, and I think in order to understand how to touch someone or to reach someone, you have to be able to have walked in their shoes. And I think for a lot of this conversation, the biggest thing I will just say is when we get into this conversation and who are we portraying, we see that it's not just skin color, it's also whether or not you have a mental health diagnosis, whether you have a developmental disability and how are you seen. There's this unfortunate human desire to find what is different about someone else, as opposed to what actually unites us and brings us together. And I would say for a lot of those things, and what I would really point to in terms of changing the narrative, it really is how do we figure out, and I think in a lot of the stories that come up, what you really find out is there was someone who was trying to get help, failed in trying to get help in many different ways, and then you get to some really bad outcomes. The point about access is huge, but I would say very much, and this is my comment about juvenile justice, because that's also I'll just say skin-based issue, skin color-based issue. When I say 7 out of 10 people have a mental health issue, are the largest place in our nation where mental health treatment occurs is in our jails, which are also predominantly filled with black youth. And that is something that we have to fix. If we want to say the kids are not all right and we need a different path, it's also a juvenile justice answer as well.
Yeah. And I would add something, and I think that to bring equity into the equation, I think that anytime anyone is going to pick up an arm and is going to fire, or you're going to fire for multiple reasons or take innocent life, mental health is involved. Whether it was isolation or loneliness or issues, anytime that individuals go to those types of extreme events, that you're going to purchase a weapon, you're going to go into a school and you're going to shoot people, mental health is present. That is not a normal act. It is not an act that normal people do. It is not something that without mental illness being present, you're going to act on. What I would say that has changed, going back to your question, that is a great advancement in clinical care is trauma-informed care. And that is something that is different. So before, we used to just treat, the individual, or we used to say we recognize it as mental health illness. Trauma-informed care, especially in trauma departments and emergency departments and care, there are now teams of social workers at these events where they immediately respond. And so whether it's all students or whether it's a mass shooting at an event that resulted from gang violence or other type of events, anytime anyone's involved, because we also know that once you see a traumatic event, the likelihood that you'll be engaged in it or will respond to it goes up dramatically. So what trauma-informed care has changed in the way that we change our care in the clinical settings is that we have teams of social workers who will say, you were involved in a trauma event, I'm going to go put all of our resources around you. so that we can de-escalate and we can make it better. And I think that's really the forms that we need to recognize and to do better, is how we still continue to build those communities and resources and be more proactive. And we found by doing that, you can de-escalate the likelihood of another traumatic event or mass shooting by 50%.
Yep.
And John, if I could
Yes.
just add to what Israel said and Dr. Trivedi said, within the administration, we are partnering with the 4 HBCUs in Maryland, because there is a need, as has been mentioned, to make sure that we have healthcare professionals that also look like the people that they're serving. And this is a need in our schools, this is a need in our hospitals, and this is just a need in our communities. Again, with the Trevor Project, for example, we need more individuals who can relate and where people can see themselves so that they feel comfortable to be able to have conversations and are not in isolation, are not feeling like they don't have people who have similar experiences as them talking to them about how they feel. So within the administration, I think we are building a bigger table so that we can have more people who have the lived experiences and expertise helping to support some of our mental health issues that we're dealing with.
Great. We are going to take some questions from the audience now. We have a couple that I believe we have some.
Yes, we do.
All right.
Hey, I believe this is for Israel and Dr. Trivedi. Baltimore Gen Z populations are facing unprecedented levels of violence and mental health issues. You guys were just discussing this. Are institutions like Kaiser and Shepherd Pratt open to partnering with local Gen Z leaders and experts to innovate those efforts?
Sure. I would start by saying absolutely. However we can learn, the beautiful thing about care, and we've learned as we talked about trauma-informed care, is that it's a learning environment. You have to hear, you have to listen. The way that we provide care needs to change and evolve. And one of the most powerful things that you have seen from especially youth that have involved in these events is their willingness to step forward and say what they need, to want to change the laws, to want to change the world and make it better. And I think that what we can do to be responsive to that is to support it, to listen, and then figure out how we can do it better, because there are always things that we can learn from one another. So absolutely would be supportive to creating design sessions and partnering however we could with individuals who want to tell us what we can do better to reach and help anyone who's in pain.
I think just to add to that, what I would say is that particularly when we talk about kids, it really does take an entire village. I will say I'm proud of the work that I get to do as a trustee of the Baltimore Community Foundation. What we're doing in terms of bringing grants locally to neighborhoods, really making an impact. And I would say within the work that we do at Shepherd as well, that example that I gave about kind of preventing kids from being in gangs by giving them a safe place to show up, having people in that situation who are actually Spanish speaking, maybe come from the country that they originate from. There are examples like that we're doing every day. I think the point though is that there's still so much more to do. As I said, we reach about 15,000 kids a year, and the reality is there are probably 2 or 3 times as many that need that help in every part of our community and right here in Baltimore City as well.
Sir, do we have another question?
Yes, we do. We have quite a few, but we only have time for one more, I believe. So I'm just going to go with one. I think that'll work for all. How does the mental health first aid training that you were discussing earlier differ between the K through 12 setting and higher ed, where the interactions between instructors and institutions and students' families are more limited? And how do we help young people during that major transition?
Very good question.
So, I can say what you really look at is the training to look at signals, how you partner. And so when our behavioral health specialists, we also have experts who train differently in adolescent behavioral health and then also in adult behavioral health, and how we look at the 2 different areas. But it's teaching our teachers to recognize certain things and then giving them resources. First aid is no different than what we learn, how to stop a bleed, how to resuscitate someone till the trained professionals come on over. So we're not asking our teachers to be trained professionals. That they're trained professionals in education, but we're not asking them to become a social worker overnight or a psychiatrist or a psychologist. But what we can do is say, here are the tools that you need. Here are the things that you should see. and here are the things that are age appropriate for you to understand that could be happening with the students in front of you. So when you see an A student withdraw and all of a sudden start getting lower grades, these are signs of escalation, which they already do, but here are some resources that you might be able to help. If you see that there's some bullying going on, here are some things that you can do to de-escalate, and here are the resources that we can bring to you that's available at your school, and just some tactics that you can bring. Because part of the time we think we're helping and we may not be doing the right thing. So it's just giving a little bit of tools, a little bit of training, and just helping them to understand where they can go, what resources are available in the community, and how they can bring help to their students. And we found that that is very well received and and it sets a lot of teachers at ease, and it helps them have a little bit more energy in taking those challenges.
First Lady, I think you wanted to say something.
I would just say, one of the best things that government can do is invest in the experts who know what they're doing, and to break down the silos that may exist, not because people are intentional about being in a silo, but because we're all going about our day doing our work, but making sure that we are meeting with the experts who have a real expertise in solving some of what may feel like a very intractable issue. And so again, when I think about the investment of $200 million by the Moore-Miller administration into mental health initiatives, making sure that we're training more experts, making sure that we're providing more resources to communities so we can have, guidance counselors and teachers who have working knowledge of how to identify issues, or if it should get to a point where they have to go to a Kaiser or a Shepherd Pratt, that there are more people and experts to be able to work with. So we're really proud of that work.
We thank you.
And we have enough time just for one parting word from each person. Is there any advice that you want the audience to have and people who are watching?
I would say to know who you are and stick true to that, because chances are there are so many of us here that would think like you and feel like you. And if you can just be a good representation of what it means to be a version of you, you never know who you can inspire and you can help along the way.
Same thing to you, Dr. Trivedi.
I'm going to, speak to the importance of hope. When does somebody reach that point where they're going to end their life and think about it is when they lose hope. And we want to partner with everyone across our broad community to get to solutions today that actually make a meaningful impact in people's lives and give them the hope to fight until tomorrow.
Israel.
So I would just say keep supporting one another. Be there for each other. When you see someone needs help, help them.
I would say as a mom that, I know this work is very difficult, and I would encourage everybody to find their communities where you can tap in to find your strength. Because I believe, these children are pretty strong, but I think that if we come together as parents, as people who know what's best for our children, we will be able to feel stronger in our parenting. So I would just encourage you to feel in your conviction that you are doing the right things for your children, and it's okay to say no.
Thank you all so very much for this great conversation, and thank you, audience, for listening. I hope you all got something out of it. I certainly did. So thank you all very much for having us.
Thank you, John.